Welcome to ReCo-My Story Season 2. Today we have Mrs. Karuna Kumari as a guest from Hyderabad. Welcome to the show, ma'am.
Hello.
Hello.
Uh, Hello.
Yeah, ma'am.
Okay. Hi, everyone. I'm Dr. Karuna Kumari. I'm an oral pathologist, a dentist who stays in Hyderabad. I have a son who is 3 months old and a daughter 2.5 years old and husband. So it's a nuclear family. We are staying in Hyderabad. Our parents stay in Delhi.
Okay, and how are you feeling today, ma'am?
Today I'm very happy. Now I'm enjoying the weather of Hyderabad, which is cold and nice. It's raining.
That's wonderful. And if our listeners would like to know how was your experience?
Okay. Uh, to be honest, it was not a nice experience. But if you stay calm and you take care of the basic things, then I think the journey will not be that difficult for anyone. For us, it started with our daughter. She is 2.5 years old. Although I'm a doctor, I understand this infection. I was pretty much taking care of everything. Like we were not stepping out of the house. We were always wearing the mask. Whatever grocery items or necessary items we were buying, we were pretty much sanitizing everything. Even the milk man who delivers the milk every day, I used to sanitize the milk packets and then get everything inside the house. Doorbell, everything was taken care of. But only one mistake which I did, I was letting my daughter to play with my neighborhood kids. So that is how it started. One fine day she got fever. I thought she's getting her molar teeth, so I did not pay much attention. Second day also she had fever. Then also I was ignoring it. Third day her fever was coming down. Then I was like, okay, fine, now she's fine, she's eating, she's enjoying. Then the fourth day, my husband got fever. He had body ache. Still, we were not getting any clue that we can be infected with COVID because in my mind, I was thinking, I am taking care of everything nicely. We are not going out of the house. So COVID was never there in my mind. Then fifth day, I got fever. Then I was like, it can be COVID. So my husband thought maybe it's not good to get my daughter tested now. So he got himself tested at home. Then second day, that was second day. It was already sixth day. So I got fever. My fever continued for 2 days. My husband, by this time, my husband and my daughter were pretty much fine. They recovered from the fever. They were eating, and they were relaxed. Then it was third day for me. I still got the fever. Then when it was third day for me, it was already a seventh or eighth day in our house. My maid was also coming. She was helping me. She was doing the household chores. And still we were like, maybe it is not COVID because both of them have recovered. Maybe it is just a seasonal flu. My fever will also go eventually. Then that evening, my son got the fever. Then I was like, maybe it is COVID because all of us are getting fever in a sequelae. And then I rushed to the hospital because my son is very small. He's just 3 months old. I don't want anything for him to be, ending up in serious condition. Then I went to the hospital. This very nice hospital. The doctors were very good. It's Rainbow, Nagar. I just went and I told the pediatrician. He was like, "What is your chief complaint?" I was like, "My son is getting fever, and this is all has happened about my daughter, my husband, and then me." And he's like, "Any cough is there?" I was like, "No, no cough." He was like, "You be assured, your child will not have any severe consequences. His vitals you just monitor. He will not be in any trouble, even if it is COVID."
Okay.
I was pretty much relaxed. Okay, my son is my kids are fine. My daughter has all even if it is COVID, my daughter is fine and my son is not going to be in a severe problem. Then the pediatrician told you should not worry about your kids. Just monitor their vitals. But yeah, for adults, it might give some problems. And then I got my son tested there. By the time my husband called me in the hospital that he has got his report and it is positive. Then I was like, okay, it is COVID only. We were thinking it is a seasonal flu or something. It is not that flu, it is COVID. Then I came back to the first thing is like I was reassured the doctor has convinced me kids are going to be fine. My daughter is already fine. I have to take care of my son. The other thing which came to our mind since we are residing in a society, kids coming to our house, neighbors, kids are playing with my daughter. It's like we have to break the news. I don't know how people are going to react to it. So we just wrote a nice message in our society. We are family is positive. So please stay away from us. Then yeah, obviously we got some positive response from the people. They were like, we'll help you with the food and all that. But you can stay at home, stay calm.
Okay.
Then my son,
Before, yeah, if when I'm listening to you, then those days must have been really very stressful because such young kids and knowing that okay, their immunity is still building up, it's in the process, and hearing all the news from everywhere that this ailment or this COVID is like, very harsh on people. At times, we've listened in the news and know of our relatives that how it has happened or affected them. So the assurance from the pediatrician must have really been a big relief.
yeah, that is the only relief. I was like, yes, my child are safe. The moment doctor said, even I am a doctor,
Yeah,
when he said your kids are going to be fine, you just monitor their vitals. If at all you see any changes, this is indicating this thing, you then come to the hospital. Otherwise, we can just do a video consultation. You can manage it at home. That was a big relieving factor. They
mm-hmm.
are not into see sometimes you literally feel god, doctors are god. When they give you such kind of assurance you really feel. Otherwise people are just prescribing drugs, unnecessary medicines, they'll call you to the hospital. That kind of environment was not given to us. I faced a very decent doctor. He assured me, and literally our journey was better when we got to hear from the pediatrician, kids are fine.
Yeah, must
So
be
that,
like very calming at that.
yeah, that was very calming. And yeah, obviously we were in touch with the doctor every day for video consultation. We took our precautions from our own side. But yeah, health doctors' words were like very much assuring for us.
So, what thoughts helped you to stay strong?
For me, staying strong was like my kids recovering from it, my husband recovering from it, and when my daughter recovered from it, she was playing, eating. So I was like, my son will also recover. I will also recover. And then there was a support from family from Delhi. So all this helped me, that I have to take care of my family. We'll be fine. This is just a temporary phase. It will go.
That's very true, and you have rightly said, when the kid starts recovering, one's own, the pain or whatever one is going through, the tiredness, the fatigue part, that also starts coming down.
Yeah, that is there.
Kids are like a big motivators. That's and anyone in your family, like your parents, somebody like you just mentioned, they were your support system. How did they
Yeah,
take like
obviously.
because they were not there with you and everyone
Yeah,
getting affected? So what was their response?
yeah. Actually, my parents, although my father is 60 plus, he was vaccinated with both the doses. So he was like, I will come with you. I will come to Hyderabad. I will stay with you. I know this infection has a different reaction to different body. Considering his age, I did not allow him to come here. Even my sister wanted to come and help me. I was like, no, you people stay safe at your place. We will be fine. It's anyway. If any emergency is there, we will call you. But right now we don't require. So to your parents, you can always, or you to your family members or relatives, you can, unless and until you really need them, don't call them, because if you are infected, there are chances once they come and stay with you, they might also get infected. So if you have milder symptoms or moderate symptoms, I think fairly we can manage. But yeah, with phone and video call, if they see us, they'll also feel better. So we should always be connected with them. Every day we should update them. We are fine, we are doing good, all this has happened and now it's going, so will be another 2 3 days will be fine. So I think parents will also be happy that kids are safe and kids are doing good.
Absolutely. So your decision was very wise and very thoughtful. And the way you connected, were there any low moments?
Yeah, there was one low moment. Like my fever was not going for the third day, and then I was getting cough. Then there are few relatives who told me, even I am a doctor still, people were telling me if you have cough, the infection might go up to the lungs, and maybe you already have an infection in lungs. So I took a video. Then he advised me for a CT scan of chest. I got the scan done, and there was a mild infection in my lungs. So I used to be like, what if it becomes severe? What will, if something happens to me? Who will take care of the kids? What if I have to go to the hospital? Who will take care of the kids? I'm not in a position to call anybody from home also. All these things, thoughts were there, but my husband was always like keeping me positive. He's like, see, I have recovered, you will also recover, so don't think, unless and until you have some vitals which are indicating hospital visit or something like that, you should not be thinking negative. You should stay positive that you will come out of this. Your oxygen saturation is fine, and your fever is also going down. You will be fine in 1 or 2 days. So that is how I kept myself, okay, fine. I'll, since he has recovered, and maybe I'll also recover soon.
So it's like even despite of being a doctor and knowing the intricacies, like, okay, this will happen if this is not happening, all those thoughts, but you managed yourself to lift your mood up with the help of the positive vibes that your husband passed on to you.
Yeah, that is one thing. Even though I am a doctor, once you will not face the infection, you will not know how you are how you are going to be emotionally in that situation. So since he recovered and he was pushing me, it's going to be fine, it's going to be fine. And he helped me a lot. I could manage it. Then otherwise, with two kids and getting this infection, so it is difficult.
It must
And
have
maybe
been.
since we got the report late, we came to know after 5 6 days. Already those fever days were over, so we were fine by that time. See, okay, the fever is going. Another 1 or 2 days will be fine.
Sometimes the delay also helps in recovery.
Yeah, but it should not always happen. Since we
Yeah,
did not know initially, I could not protect my son. If we would have thought on the first day of my daughter getting fever, we should, yeah, we could not have isolated her, but we would have wore mask in the home itself. So we would, my son would not have got infection from me. We all three of us would not have got the infection. So I think we should not delay in anything. If somebody is not feeling well, you should not think it is just because of change in the season or some tiredness. You should not think, you should isolate yourself, or if you are not able to isolate yourself, at least wear a mask at home so that other people don't get infection from you.
very true, because nowadays the symptoms are masking the natural symptoms that happens for the flu or the change of climate. And
Yeah,
as you have rightly said, we should not delay right now, especially when we know that the symptoms will be similar, but it could be um, due to COVID, or it could be due to normal flu also. But we should chalk it out and eliminate the symptoms, like whatever the cause is.
yeah, that is what we did a mistake. So I don't want anybody to do this mistake, because see, we could recover all of us, but there can be parents staying with us. If we delay in all these things, they might get infected because of us. So The day you are feeling not well, you are feeling tired, fatigued, you have little fever, try to isolate. If you are not able to isolate, at least wear a mask at home so that you are not giving infection to others.
That's a very good advice that you have given right now, that we should be vigilant and we should be alert. If we find the flu like symptoms, if anyone is having those, we should not ignore it. We should take it as a priority.
Yes, at least it will help the family members not to get infection from you.
Absolutely. And you would like to say anything to our listeners? Any message that you would like them to keep in mind?
Yeah, first of all, we should not panic. Now there is a treatment. There is every possibility. People testing people can come at home. They can test. They can give results. You can now. You can take video consultations from doctors. You will get everything at your doorstep. So we should not panic. If at all you're feeling some symptom of it, just isolate, wear a mask, and then get yourself tested that particular day only, and start a video consultation with a good doctor. Take a lot of fluids, take rest, keep positive mind that you can recover. Because people are recovering at home only. There's no need that you have to rush to the hospital. If you address your problem on the day one itself, I think you will not end up in severe situations. You can manage this infection at home only, and within like weeks time or 10 days time, you will be fine.
Hmm. That is
And
wonderful. Anything from your experience? One thing you have said, yes, not to delay, and if at all you cannot get it tested, at least start wearing mask at home. If the child is
yeah,
small
that
and cannot be isolated or quarantined.
yeah, definitely your kids will not stay away from you. You cannot keep them in a separate room. They will always be with you. And if at all kids are getting infected, you wear a mask so that you don't catch the infection, because another 2 days they'll be fine. What if that infection is going to be severe for you? So keep them hydrated, keep giving them food. You yourself should take a lot of fluids, take rest, and try to stay at home only, stay safe at home.
Okay, that's nice. And how are your parents? I remember that you had mentioned they also were unwell.
Yeah, my father had took both the doses of vaccination. I think the around same time when he took the second dose of vaccine, he got infection. So initially he was having fever, so he was thinking it is just because of the vaccination. And then 3 days continuously he had high fever, and he was developing cough. Then since I got the infection, I knew which steps what he has to do. So I was like, no, this is not the time that you should be sitting at home. Although you are vaccinated with both the doses, you please get a CT scan done. Then he got the CT scan. He had moderate infection, but then I was already experienced with this infection, so I was like, you stay calm. With video consultation only, we'll try to manage. If your vitals are fine, your oxygen saturation is fine, then we consulted a good doctor, and he gave him medicine, and my father started recovering. So now he's fine, he's doing well. Although my mother also she's diabetic, she has hypertension, and she also got the infection. Although my father isolated himself, but once, because initially 3 days he did not took care of all this thing. So everybody in my family, my mother, my grandmother, my brother, and my bhabhi, all of them got infected. But they had fever only for one day. So for my mother, although my mother is having diabetes and BP issues, we were thinking it might be a problem for her, but because she was vaccinated with one dose, she did really well. She had only fever for one day, and then she was fine afterwards. But my father has recovered nicely, but we should there is COVID recovery thing is also there. We should
True.
always follow up with the doctor since now a lot of infections are coming. So it's just not COVID. After COVID also, if you have moderate to severe symptoms, you should consult doctors if at all some changes are happening in your body. So you should always be in touch with your doctor. If you got yourself admitted, you were on oxygen therapy or you were on steroids for long term. So better any movement is happening in your body, you should consult your doctor because
Okay.
a lot of infections are coming up after COVID also. So you should not ignore any of these things.
True. And your takeaway from this recovery, your personal takeaway, like, when you recovered, what did you felt and what do you want to share about it?
I wanted to share that there should be humanity on this planet because when somebody is suffering from this infection, you should not treat those people like you will get infection from that person. Because if I am infected, the doctor treats me in the same way. How will I recover? The doctors are also doing their job. They are seeing the COVID patient every day. So neighbors should also treat you like the same way. They should not be coming close to us, but they should help with the food and whatever help they can offer to us. So I have learned to be like, you know, life, God has given very short life. We should help each other in this testing time. We should not be mean and selfish. This is what I have learned. And since I recovered, other families who are getting infection in our society, I'm trying to help them with the food, whatever they needed, and some help of doctors and any video calls. Like I'm trying to keep them motivated. This is what I'm doing, and I think everybody should do this. Um, at least with the basic food, we should help each other.
That's so sweet of you, and I'm sure after listening to you, people will realize its importance that yes, we should be, concerned and have that humanitarian feeling for each other in the sense that when somebody is infected and we know that they don't have any other help, so we should come forward, at least as you have just said, to provide the basic things like food. It will be of great help. And you are doing a great job. And before we wind up, any special message you want to give to our listeners?
Uh, yeah. First of all, avoid going out, and uh, any disturbance in your body, if you feel, please isolate, wear a mask, and I think I know we need since we stay with family, we take a lot of help from mails and all that. It's better that we can avoid any unnecessary contact with these people. We can give them salary for a few months just like that, or even if somebody is coming, then we should take at most precautions of wearing masks. They're wearing masks. All this should happen because I think prevention is the best cure for this because we don't know how this infection is going to trouble you. It can be mild for you, it can be moderate, it can be severe. So it's better that we should do the prevention to the best from our side.
That's true. And you have rightly said that we need to educate even the helpers that come at home to help us to wear proper mask and how they can also take care of themselves because every life is valuable.
Yes, because we should not be infecting them, and they should also not be getting infection from them to us. I think we should be wearing masks, sanitization. First is prevention. We have to prevent that. That can happen only by taking care of sanitization properly.
Very true. And it's lovely talking to you, Karuna. And thanks for all your tips, the practical tips, in fact, that you have shared. And hats off to you and your family to stay calm and the way you have, dealt with the situation, having small kids and yet not getting panicked at that point. And you did what you could do to recover in the process by helping each other, motivating each other, and being there now for others. It's a big thing, and I really appreciate it. And thanks on behalf of all our listeners also.
Thank you so much.
Thanks a lot and take care. Be safe.
Okay. Bye. Take care.
Bye.